It's one of my favorite therapies. It's called pulsed electromagnetic field therapy, or PEMF, and it's based on the science we have of electromagnetic resonance. So we know that there's a certain electromagnetic, we call resonance, if we think back to our physics, but there's a resonance that all healthy cells need to have in order to function properly. So that involves how they take in nutrients, how they make energy, how they do their jobs. And so one of the things we see in cancer is that electromagnetic frequency is off. It's imbalanced. And so that's a stark contrast you see from a normal cell to a cancer cell. And so the whole idea behind PEMF is getting the body back into balance. So it's actually a therapy that's used for a lot of different things. It's not just cancer. I mean, there's some good evidence on people with chronic pain, arthritis, you name it. I mean, there's a lot of diseases have some good evidence showing that PEMF can be helpful. But the way I use it is, I have a therapy pad, and it has little coils in it. And so when the patient lies on that pad on like a massage table, they lie on their back and just get small little pulses of electricity. And the nice thing about the one I use here in my office is we can program the frequencies to match the ones that we know have been effective against cancer. So I use different frequencies for different treatment sessions, all aimed at sort of getting those cells back into balance. So it's about an hour treatment. It's painless. Many of the treatments, the patient can't even feel the pulsing. Sometimes with stronger frequencies, they will. But I found it to be very well tolerated, no side effects. I do usually twice a week for patients that are kind of doing my in-office program. Yeah, there are a lot of them out there. Some are great, some are horrible, but the one I really like is called Curatron. They're a company in Israel, and they have a lot of research behind what they do, and so I researched it a lot before I got one, and so I'm a big believer in what they do. So and I do have an at-home model. I don't recall the cost, but it's definitely cheaper than the professional models. But especially for patients who are wanting to kind of do all they can at home, because you can't be in the doctor's office every day. So I think that can be a good thing, provided they maybe have some guidance in terms of just getting started.
Nice.